Got my photos, my little brother, my little dog.
After only a year as a junior doctor, Tom is quitting the NHS and moving to Australia. He says he can't work in a broken system anymore.
I'd be dealing with a critically ill patient and having tasks coming through on my phone saying that a patient on the other side of the hospital needs me, but I know deep down that I won't get to them on that shift because they're 43rd on my list, and I've got patients that are in front of them because they're more unwell.
Before I'd even had a chance to put my bag down, I was called to a deteriorating patient.
For Tom, it's not just about the money, it's the lack of respect and poor training.
Do you have any sympathy for your patients who you say aren't receiving the care that they deserve, and yet you're jetting off to a life in the sun?
I do feel guilty in a way because I want to be able to provide for the NHS. I want to make the NHS better single-handedly, but I can't sacrifice my own happiness, my own mental health, my own physical health.
20 months of industrial action has taken its toll. It's one of the reasons why British medics are being targeted by overseas recruitment agencies.
We've definitely seen an increase in the last 2 years or so, particularly around the junior doctors. The strikes that are going on over in the UK, which obviously makes a bit of uncertainty. But again, natural progression with the borders having opened up post-COVID. At the same time, the senior doctors, there's a lot of inquiries starting to lift up around there for them to.
£2.6 billion was spent on undergraduate clinical education in England in 2022-23, with a further £2.5 billion spent on postgraduate medicine and dentistry. But in England, only 56% of doctors in core training, that's the period after finishing their 2 foundation years, still work in the NHS 8 years later. And around half of that loss is seen within the first 2 years. A pay deal has been put to the junior doctors, but health policy experts warn more money alone will not fix the problem.
We're in uncharted territories to some degree here. This is a large amount of money that's been put forward, and it represents a significant increase in pay. What we don't know is the extent to which it will solve some of the key issues. So that early career retention, we don't actually know what effect this size of pay deal will have.
The Department of Health and Social Care told Sky News the NHS is broken, and the Secretary of State has been clear he wants to work with junior doctors to get it back on its feet and improve working conditions. Tom hopes so. He wants to return to the NHS one day, but only when he thinks he can do better for his patients.
I miss you a lot.
Ashish Joshi, Sky News.